So let me ask you a question. Why is it that some of the simplest principles of efficiency in patient care are the ones we break most often? Here's the reality. When we violate them, we make life much more complicated for our teams, slower for ourselves, and less inviting for our patients. But when we follow them, practices grow, your team actually enjoys coming to work, and patients say yes. So let's talk about the 3 universal principles that every dental practice needs. The first principle is so obvious that it's right in front of our noses, but we often can't see it. We create processes that are so complicated that new staff members can't figure them out. And experienced staff get frustrated with these nice new people. And then what happens? Training drags, productivity slows, and stress skyrockets. For example, sterilization should be a linear, one-piece flow that is fast to execute and easy to train. But even with many of the fancy so-called Stericeners, it still isn't obvious. Inefficient workflows pile on extra steps, waste time, and raise the risk of cross-contamination, making life harder for your team. Likewise, managing inventory can feel complicated. But with the right setup, clear tilt bins, purpose-built procedure accessory kits, and simple supply pull-downs, you can keep everything in one place. It's easy to see what actually needs restocking, and suddenly, managing inventory becomes simpler than a trip to the supermarket, because every item on your shelves is something you actually use. Here's the truth. Simplicity scales. Every hour you invest in making systems easier is an investment that pays off for the lifetime of your practice. So ask yourself, why are we making things harder than necessary? The practices that win are the ones that simplify life for staff and patients. It's almost laughably simple. It's about geometry. Most dental offices break this rule every single day. You get paid to work in the mouth. So why are half the instruments you need to work in the mouth across the room somewhere, behind the chair, or buried in a cabinet? Ideally, each treatment room should be fully stocked to handle about 90% of the procedures you perform most often, what we call your 90% procedure profile. The remaining 10% of those less frequent procedures, such as endo, ortho, sedation, surgery, or whatever it is in your practice, should still be ready for chairside delivery at a moment's notice. And the best way to achieve that is with procedure-specific supply tubs and readily deployable mobile carts, allowing you to bring exactly what you need when you need it, wherever you need it. If there's something you need for a procedure that is not within the range of motion, it might as well be in a warehouse down the street somewhere. And as dentists, we should not be in the warehousing business. We need to provide efficient dental care to our patients in a relaxing spa-like environment. And the faster that care is delivered, the happier the patient is. You can store instruments behind the patient, but they're hard to reach. Or if you put them in front, you'll quickly run out of space, and anxious patients don't want to stare at them anyway. The best option is what we refer to as over the head. It's a placement that keeps supplies easily accessible to you, yet entirely out of sight for the patient. Smart practices design their operatories so that everything the doctor and assistant needs is right where they need it, within reach, without cluttering the patient's view. Because when you minimize wasted motion, you maximize production. Doing this eliminates storage clutter inside the operatory and delivers true on-time performance. Remember, you can't use what you can't reach. None of this matters if the patient doesn't say yes to treatment. Even if you have simple systems, even if you placed everything within reach, if the experience isn't emotionally acceptable to the patient, they'll decline your recommendations. Every day we see offices unintentionally encouraging patients to say no. So ask yourself, what does this treatment feel like to your patients, especially an anxious one? Too often we confront them with intimidating instruments that spark fear in nearly half the population, and we don't have to do that. Lighting is another issue. Most operatories use bright, high glare lights aimed straight down into the patient's eyes. From their perspective, lying back and staring up feels less like care and more like interrogation. Would you want to be treated under interrogation lights? Of course not. Yes, you can counter this with sunglasses for the patient, but then you've lost an important emotional connection with the patient. You can't really see how they're reacting to your care. Better lighting and design can change the entire emotional experience. Your design has to be efficient, yes, but it also has to be emotionally inviting. Because patients don't just buy treatment plans, they buy trust, comfort, and confidence in you. So here's the challenge. If your systems are too complex, your staff struggles. If your instruments aren't within reach, your efficiency fades. And if your environment intimidates patients, they say no. But if you just embrace these three principles, simplicity, accessibility, and patient-first design, you create a practice that runs smoother, treats more patients, and earns more yeses. The best practices don't succeed by accident. They succeed by designing their systems, spaces, and experiences around these principles. So the question is, are you ready to build that kind of practice? Take the first step today. Let us help you design a practice that's simpler, more accessible, and built with patients at the center. And thank you for watching. Make sure to remember to subscribe so you won't miss any new releases that we have. We constantly try to update and give you more information about how to practice the best way possible.